Imagine you are sick and you walk yourself into a health facility expecting to be diagnosed of your ailment and get treated. Then you meet a doctor who sends you to a referral hospital because he has no relevant equipment to work with. How do that feel? Well, that's the scenario some Malawians find themselves in when they seek medical services in some of the country's hospitals. According to media reports, the situation is being exacerbated by some unpatriotic Malawians who steal medical equipment from the country's government hospitals. This then raises the need for concerted efforts by government and non-government organizations to improve delivery of health services in the country. Against this background, Malawi Healthcare Support, Mahecas, has donated assorted medical equipment to Mbulumbuzi Health Center. Items donated include scales for weighing newborn babies, scales for weighing grown-up patients, thermometers, a bicycle ambulance, stethoscopes, just to mention a few. Speaking after donating the equipment, a representative of Mahecas in Southern Region, Lawrence Gogodas, appealed to medical personnel to take care of the equipment so that it serves the community for a long time.
The message to the users is I just ask the members of staff here at Mbulumbuzi to take care of the equipment they have received, like the bicycles. They need to give maintenance when it's broken. Make sure all the items are being taken care so that it should give the purpose to the general public.
In his remarks, District Health Officer for Chiradzulu, Jamison Chausa, said the medical equipment will improve quality of delivery of health services at the hospital. He appealed to other well-wishers to emulate Mahecas' example, as most of the health facilities are overwhelmed with demand for medical services necessitating continuous supply of the same.
The equipment that we have received today will go a long way towards improving the quality of care that we'll be providing at this facility. To begin with, the identification of the needs was actually initiated by us in terms of coming up with priority areas that we needed Mahecas to assist. And therefore, whatever we have received today is addressing actually the critical areas that we had a gap. So now, from now on, now that we have received this equipment, our provision of care will be strengthened. Some of the equipment is also helping in terms of diagnostics, so we'll be able even to identify cases like diabetic cases, which we were not able to do before. We used to be referring every other person that we suspected diabetes. This time around, they will be monitored right here. So in terms of blood pressure, we also had very few BP machines. Today we have adequate, so we'll be able to provide adequate care in all the sections at the same time, other than waiting for an equipment that is being shared within the facility.
Mbulumbuzi Health Center serves a population of over 18,000 from the surrounding villages and afar. McDonald Chiwaula, MPC News, Chiradzulu.